Hi, I am Dr. Nelson Pinto. I am a consultant orthopedic surgeon specializing in arthroscopy and sports injuries. I have worked as a sports injury specialist for FC Goa in past years. At present, I am the team doctor, orthopedic surgeon and the sport injury consultant for the ATK Mohan Bagan and the Lucknow Super Giants. Today I like to have a small talk on hamstring and hamstring injuries. So to begin with, what are hamstrings? So hamstrings are a group of muscles which are present at the back of the thigh. So they start from the origin is mainly from the upper part of the thigh and they go downwards towards the knee. And we have three muscles which form the components of the hamstring muscles. One is the semimembranosus, semitendinosus and the biceps femoris. Now the most doubts most people ask me is what are these hamstring injuries? So hamstring injuries can be of three types mainly, although there are various grades, but I would like to put it in three ways. One is a stretch injury that usually we say as grade 1. The grade 2 is a partial injury where there is a partial tear of the hamstring tendons, and the third one is a complete tear of the hamstring tendons. So these are the simple classifications I would like to highlight for any person to understand. So now what is the problem? Why do we get a lot of hamstring injuries? So hamstring is one of the group of muscles which are very strong and more commonly used a lot by normal people as well as in sports persons. And sports persons use it on a very long basis. So when you have no proper strength or the flexibility is compromised in these group of muscles, they are easily predisposed to injuries. And when these injuries are not identified at the right time and not treated adequately, this may result in a long-term problems and a chronic problems which can haunt any person or a player for a long period of time and also can affect their careers. Now what can we do with this hamstring injuries? So when you get a hamstring injuries, the first part will be the conservative treatment, which mainly involves giving a good rest and good compression and taking a small period of rest, maybe for 4 to 5 days. We do start them on certain analgesics and some medications, and once the acute phase is settled down, then we reassess the patients and then we do a proper rehab for them. So this will be monitored with the multidisciplinary approach between the doctors and the physiotherapist, and as a team this will be done, this will be achieved on a greater spirits. And now many people have a lot of doubts about hamstring injuries, asking do we need surgery for all the hamstring injuries? As I said when there are different type of hamstring injuries, certain injuries are mainly at the level of the muscle, there is a muscle tear or a muscle stretch. Some happen at the muscle and a tendinous junction, and the third at the tendon aspect of it. So there is one more aspect to this hamstring injuries, and that is called as the avulsion injuries. So what happens here is at the origin or the insertion, the group of muscles can get avulsed from the bone. That's from the origin at the ischial tuberosity, which we say in the upper part of the thigh, or from the lower part, that's towards the tibial insertion. So that is on the leg. So usually when there is an avulsion injury, that is where surgical treatment is usually recommended. And if the muscle injuries, as I said the hamstring, you can see a part of it as a muscle, there is a tendon and there is a junction, it's called as a musculotendinous junction. So any injuries in the muscle, usually it's very good results is only by conservative treatment. So being in practice with normal people and also with sports persons, we hardly do any surgeries for these kind of cases, but usually they heal very well over a period of time. The musculotendinous junction injuries, although they are also not very complicated, but because of the tendinous and the location of these injuries, we try to be more conservative, and also we try to give a longer duration so that the re-injuries won't occur, because these injuries are known to recur. And when there is a tendon injury, definitely takes a longer time compared to the other two injuries. And avulsion injury, as I already discussed with you, that most of them go for surgery. Now how long do the injuries take to bring back a person or an athlete back to the pre-injury levels or the pre-sporting levels? The answer is very simple. I always give very simple, and that is it depends on individuals. So never give a time limits. This is what I've learned when I've been in sports, in the sports team. Every body is different, every recovery is different, and every person or a player has a different recovery potential for every injuries. The best case will be that since the advantage I have or we have in the sports arena is that we see these players day in and day out and monitor them on a daily basis. So assessments will be done on a daily basis, very importantly, and then we decide what is the progress achieved by the individual person, and we progress them in the rehab wise as well as the management wise accordingly, and see that the whole goal of getting a rehab will be to see that the discomfort or the pain will never be a part of the rehab process. So as early as possible we'll try to get the player well within the sporting time. To summarize with the hamstring injuries, I would like to say the first thing will be to identify the injury. For that we need to diagnose it very importantly. Second thing is a good treatment. Third, a good rehab. So when these three things are done in a systematic way, I'm very sure that hamstring injuries can be handled in the most successful way for the players as well as the patient, so the players can go back to their pre-injury levels, and also for the patients who can lead their life peacefully. Thank you very much. Any queries related to orthopedics or musculoskeletal issues, you can contact us at our clinics or at our website, visit our website for any queries. Thank you very much.